Welcome to today's episode of the Medical Fitness Podcast, powered by the Medical Fitness Association and MRF Institute. My name is David Flench, and I am the president and CEO of the Medical Fitness Association. I'm co hosting this episode today with Jeff Young, co founder of the Medicine, Rehab, and Fitness Institute. Hey, Jeff.
Hey everyone, we are excited to have on our show with us today Michael Stack. Hey Mike, can you begin by sharing more about your background with our audience?
Sure, delighted to be here. Amongst friends, David and Jeff, we run into each other a lot. Thank you so much for having me. On a high level, I would say that I am an exercise physiologist by training and a health educator and a health entrepreneur by trade. Spent over 20 years in the commercial fitness industry and have evolved my career into several different facets that we'll talk about, but start from an exercise physiology background and then have broadened from there.
Well, Mike, as you and I have talked about a bunch of times, I'm going to have you expand on that a little bit if you don't mind, because as you know, I'm so intrigued by your career path because it's led you to having such a unique and broad perspective of the industry. Your roles as an entrepreneur, kinesiology instructor at the University of Michigan, board member for the Physical Activity Alliance, a regular presenter at major conferences across the United States, and well over 100 episodes into hosting your own podcast, and all the candid discussions and learning experiences that have been a part of all that. Love for you to dive a little deeper into your career path and experiences, and maybe provide our listeners with some unique perspectives or advice.
Yeah, I love this question because I talk about this a lot with my students, with our team, our employees, and just professionals in our industry. I think if you looked at my CV and all those things you just kind of laid out, you would almost think like, does this guy know what he's doing? Does this guy know what direction he's going? And the answer is yes for the most part. And I'll tell you what I've allowed to lead me down the path that I've gone on. And I think there are some valuable learnings from the audience for the audience here. I am a very values driven person, and I have three core values that I live my life by. One is growth, the other is service, and the last one is impact. And essentially, what I've done at various stages in my career is I've said, how well am I living these values every day? And what more can I be doing to live these values? And as somebody who is growth oriented to be in service of making an impact, that has just led me successively to additional ventures. So, first I was just simply somebody who, I worked for Bally Total Fitness. Yeah, you mentioned you've had Amy Bantham on the podcast before. Amy also started her career, at Bally Total Fitness, and I was able to make an impact there and grow and be in service of my clients. But then I asked myself, okay, what's next? And then that led me to the logical conclusion of, okay, I want to be an entrepreneur, and instead of just me working with somebody one-on-one, I want to train other exercise professionals to work with many people. And so I did that. And then I asked myself on reflection, could I make a bigger impact? And how can I be in greater service to our industry and to people? And that led me to starting the podcast to do education, which I know is very resonant with both of you. And I think really where it's led me to now is the realization that to maximize my impact and my level of service just to the world as a whole, working in the policy and systems change space is where I think I am most passionate. You made reference to the board work I do with Physical Activity Alliance. That's the leading group of physical activity stakeholders that focus on policy and systems change. And that is the top-down approach to making change in society. So all that to say, I think the way to sum up my career trajectory, which I know will evolve from here, because my endpoint is not a certain amount of money. It's not a certain title or a certain level of success. It's always asking myself how I'm stacking up against those values of growth, service, and impact. And when I find that I'm not able to do it anymore at the level that I am at right now, then I just elevate to the next level. So that's kind of led me down my career path, very values oriented.
find that extremely intriguing because I've never heard uh, those, 3 core values. I've never read, that, and so it makes me curious. Is that something that you came up with yourself, or did you learn that from somewhere?
I don't know what happened when I was 18, 19 years old, when I started to do these values exercises. But, I read something at some point, and again, it's a half a lifetime ago, so I can't remember what I read, but I did a values exercise and I started to realize the importance of doing things that were in alignment with my values. And as I went through my 20s, I started, and my values have evolved over time, like they do for everyone. I started to realize the more things I did that were in alignment with my values, the better I felt, the more fulfilled I felt, the healthier I felt, and that just carried forward. And I think the thing that's really solidified for me the importance of living a values driven life is the work that I've done in my company, Applied Fitness Solutions, not only with our organizational core values, but mentoring a bunch of 20 somethings on our team to navigate life. I think I've seen how really articulating your values and living your life by those values take out a lot of ambiguity and add a lot of certainty to your life. But to your point of you've never heard those exact values before, I think that's the great thing about values is that my values aren't right and somebody else's values are wrong. They're your values, and if you can articulate those and you can live your life by them and you can measure the things you're doing in life by them, that's going to make a profound difference on your fulfillment and also the world as a whole.
Mike, taking this thread a little bit farther, I've heard you talk about that in presentations and applied it to organizations. So not only just a person's values, but really translating that into what the organization stands for. And we did that at MFA a couple of years ago when I first got here, and I think it makes a big difference. It really guides the direction of what you're doing. Do you find that you made a little bit of mention to that within your own company, but is that something that you find is also important in that area?
A thousand percent. In fact, I think that I probably realized it organizationally more tangibly than I did personally first. And then it just kind of cemented my belief in it personally. But just to touch on that really quickly, in my organization, we hire based on values, we promote based on values. Sometimes, and this is rare, but we do have to let somebody go because they don't align with our values. I care that you have a requisite level of technical skill. I mean, in the medical fitness space, we do need people who are degreed and have certain competencies. But let's be honest, like a lot of people have degrees and a lot of people have certifications and competencies. What I'm looking for is I'm looking for the right human being for our environment. And they could be perfect for our environment and terrible for somebody else's because of their values, or vice versa. There's some people we haven't hired who I think are great. They're just not great for our environment. And I think the embodiment of that I've heard from our clients, and they always tell me this is, you hire the most amazing people. You're so lucky. And of course, you're grateful and you say thank you, and you don't want to get into a long drawn out conversation while somebody's in the middle of their workout about values and something this heavy. But that's the reason that we don't swing and miss on our hires. The reason that we've created a safe and inclusive culture is because we select not based upon academic criteria alone. That's table stakes. We select our team and we promote internally based upon who best embodies our values.
Absolutely love it. And so here you are already spitting nuggets, and I want our listeners to know that they are listening to a trio where one's a University of Michigan grad, one is a Penn State grad, and one's an Ohio State grad. So, listeners, we were at each other's throats prior to starting this podcast, and it took everything I had to say to give Mike the compliment I just did. But seriously, that's really good stuff, really good insight. And actually, one of the things you said leads perfectly into my next question, because you were talking about not only values and all the related things, but previously you mentioned your passion for policy and systems change. And I've known you since I think 2020 for about
Mhm.
4 years, and we've collaborated on a bunch of things since then. And one of them is an coming special themed issue in the American College of Sports Medicine's Health and Fitness Journal, which is, we're recording this in the month of June. It's going to be released in August. So maybe some of the listeners, as they're listening to this, it's already been released. And if it has, you really need to check it out. But you're the guest editor of this special theme issue. And but I'd love if you told our listeners a little bit more information about it. I'm curious how it came about. And why is it so important for anyone interested in building the bridge between medicine and fitness to listen to?
Yeah, thank you for that question. And yeah, I was very humbled to be asked by the ACSM to be the guest editor for this themed issue of the Health Fitness Journal. And the Health Fitness Journal, which is now currently edited by MFA member Brad Roy, who certainly both of you know, and probably a lot of the listeners know. They reached out to me and they say, we know you're very much involved in the different prongs of the professionalization effort in the exercise profession. Would you be interested in developing a specific themed issue on this topic that could act as almost a primer or a roadmap to explain what's going on from a professionalization and advocacy perspective? And one of the things that I've been somewhat disappointed in over time, but also I understand, is how little people know about all the great professionalization work that is happening behind the scenes. The work of the PAA, the work of the Coalition for the Registry of Exercise Professionals, the work of MFA and ACSM and ACE, and there's just all of these groups out there that are doing all this amazing work. And whenever I talk to people about it one on one, they're always blown away that all this stuff is happening and we're so far along. And so I think really what this came down to is the ACSM finally realized that we were far enough along in our professionalization journey in all the various aspects of it that we actually could put together a comprehensive guide on all of the different elements of professionalization. So I think first it's important that I touch on what I mean by professionalization effort, and then we'll touch a little bit more on the issue. So essentially what I mean by professionalization effort is something that where we now sit for the most part as exercise professionals outside of healthcare, even in medical fitness centers, which are by definitions departments of healthcare systems. The exercise professionals sit outside of the healthcare tent. Professionalization essentially brings us underneath the healthcare tent. Hopefully, that allows us to be able to bill and get reimbursement for our services, to streamline referrals from physicians. Essentially, it makes us what we call qualified healthcare professionals. That QHP designation that is so critical to all other allied health and medical professions that our profession currently doesn't have. So essentially, when we talk about the professionalization effort, it is the path or the roadmap to being considered a qualified healthcare professional. So that's what the effort is. And it's clearly so complex that we need an entire journal issue to describe all the facets of it. But to give you an idea of what we talk about in that issue, we talk about advocacy because there's certainly policy and systems change that need to occur at the federal and at the state level. We talk about lessons learned from the wellness coaching profession. They've recently undergone their own professionalization effort. And then we get really deep into some critical issues. Example, the article you were a co-author on with Dr. Campert and Dr. Bantham, you talked about how to build trust and relationships between healthcare professionals and fitness professionals. We talked about the technology and the electronic health records element because that's such a big part of this. We talked about program development. We had the team from the Cooper Institute, from Maple Tree Cancer Centers. We had Dr. Barry Franklin, who's been in the field for years, talk about program development. And we really were hitting all the different facets. We even talked about reimbursement, which, man, that's such a thorny topic. That was probably one of the most complicated articles for us to write in that issue. And then, lastly, we talked about credentialing and programmatic accreditation. And all of these things might sound completely foreign to you. That's why I recommend you check out the issue, because our goal was to take the assumption that most people don't know what is happening and how close we are, closer than we've ever been, to being able to achieve QHP status. This issue breaks down all the different components, and it's going to be out in mid-August. So depending on when this podcast drops, it may already be in your inbox.
I, um, I let my students know at CUNY York College in Queens what's going on. I let the leadership there know. Earlier this past semester, I presented at Penn State, and I let them know. I presented at the Obesity Medicine Association conference a couple months ago, and I let them know. And the current chair, I'm ending my 3-year term for the National Strength and Conditioning Association's Special Populations Special Interest Group, and the national conference is coming up 3 weeks from today, actually. And I actually was working on my PowerPoint presentation today for our SIG meeting, and I included several slides, like probably 4 or 5 slides on this, because you're exactly right. This is huge. It's absolutely huge, and everybody needs to know. So I'm really, I'm just so fortunate to know you, and I really mean that. And the fact that you're a board member and you've got your finger on the pulse of what's going on, and it's just a really fortunate situation. So, yeah, and I hope that we can add to the list one of these days the National Strength and Conditioning Association. There's a little bit of discussion going on with that, but I'll kind of leave it at that right now because I don't have any firm insight. But yeah, I really appreciate that overview. And please, everybody, you have to look at this issue. It is so important.
Thank you. And to that end, Jeff, I think it's not only understanding what's going on, but it's doing so we can speak with one unified voice as a profession. When you talk to the policymakers at Health and Human Services and CDC and at the state level, that they all say the same thing. We want to hear one unified message. We don't need fragmentation and fractured groups in tribalism. We're not going to put up with that because it makes it look like you don't have your act together. And for a while, we haven't. So I think this is our opportunity. And I don't want to be hyperbolic about it, but we aren't in a position where we can't capitalize on this opportunity. So reading for knowledge, but also becoming acclimated with it so we can speak with one unified voice.
Well said, guys. Mike, I want to turn to this topic. I know you've run a successful commercial fitness center for years. Um, and I can remember years ago having an initial conversation with you as you were looking to make the transition to develop a medical fitness center.
Mhm.
And so I'm really interested. I know a little bit about the background, but I'm sure this would kind of be helpful for our listeners. But in hearing about why you made the decision to go that route, and then some of the lessons maybe that you've learned along the way as you're making this transition to medical fitness.
Yeah, that's a great question. And yeah, we've talked throughout the process. In fact, one of my favorite things about the MFA is that when you need something in the medical fitness space, you just talk to the Medical Fitness Association, and they connect you with people. In fact, ironically enough, as we sit here and talk, my meeting directly before this was with Debbie Bellinger, an MFA person who's helped me out, and my meeting after this is with Doug Ribley, who's my lead consultant for my project. Both of which I met through the MFA. So it's the connections that are so valuable that the MFA has made, David. And what I said to you in that initial conversation, and what I'll say to the audience is, it kind of goes back to my first question. I've asked myself throughout my career, how am I in the best service to humanity, and how am I making the biggest impact? And what I've come to realize over, a 20 plus year career in fitness is that as soon as you have fitness in the name of your business to a certain degree, and as soon as you kind of brand yourself as a commercial fitness entity, you almost close yourself off to 75 to 80% of the American consumer. We know for almost the entire existence of the fitness industry that we've served basically 15 to 20% of the American population. We have done a great job as a commercial fitness industry of getting the fit fitter and the healthy healthier. And while there's nothing wrong with that, and that is a very admirable thing to do, I just felt at a certain point that it was not maximizing the impact that I really wanted to make in the world. And so it caused me to realize that if we were truly going to help people that needed the help the most, it couldn't be as a fitness entity. It had to be a healthcare entity. And not to dive too deep into the medical fitness difference, because I'm sure you guys talk about it a lot in the podcast, but the trust and equity that a healthcare system or a healthcare provider brings to a community is so different than that of a fitness entity. And I think my fitness brand in Ann Arbor, Michigan is a very trusted brand. But I also know that when people see Applied Fitness Solutions on the building, there's a decent segment in the market that goes, that's fitness. Fitness isn't for me. Right. So I think that that's really what got me thinking down this path. And then I learned more about the model, and it really provided me everything that I needed to effectuate the change that I was trying to make in the world, in terms of getting people who weren't moving, getting people who weren't healthy to not even be healthy, but just to be a little less unhealthy. And so, I really doubled down on it, but I did it a different way. And Doug Ridley, who is one of the originators of the Medical Fitness Association, who I'm sure you'll have on the podcast at some point. We were sitting down and we are talking about this, and he said, Mike, this rarely happens the way you're doing it. Rarely does an entrepreneur say they want to do one of these projects and then approach health systems and say, I'm doing this. Do you want to be a part of it? And that's exactly what I did. I brought Doug in. We did a market analysis. We knew what the market could bear in terms of one of these centers. And I've had relationships over the past 20 plus years with all the major healthcare systems in Southeast Lower Michigan. And I think the first lesson that I think people can take away here is that I didn't like cold email the CEOs of these health systems or just knock on the door and try to get a meeting. I'd been fostering these relationships over the course of 2 decades through a lot of different methods, board work and other things that I've done to support these health systems. So it made these conversations easier to start. I won't say easy to have, because I was bringing something to them that was not within the typical scope of services that they offered. Long story short, we had a bunch of conversations, and we found a healthcare system that we're partnering with, and it's been exciting to get to this point. I will tell you, it's been extraordinarily challenging because of the economic conditions as it relates to the real estate. And this is going to get into a lesson, I think a really important lesson that I think the medical fitness model and industry really needs to think about. But we all aware that interest rates are through the roof. I am looking in a part of Ann Arbor. Ann Arbor, just in general, is hard to find property, but I've had more of a real estate challenge than I've had a healthcare integration challenge at this point. And I'm quite sure the audience does not want to understand the lessons I've learned from a real estate perspective, because I'm pretty sure I don't even want to know the lessons I've learned from a real estate perspective. But these are the lessons that I think I would pull out that I've learned at this point. I mean, bear in mind, we just now have a letter of intent in to purchase a property, and we're going to start the renovation and not be open till probably like 2026. So like I'm still learning things. But the two biggest lessons I will tell you, one was my pitch to healthcare systems, the value prop that I brought to them for medical fitness. It was a conversation around market share, is essentially what it was. It was, hey, do you want to prevent the other health system in this market from taking patient volume away from you? And do you want to take patient volume away from the other health system? That's what got the ears to perk up in the C suites. And this isn't the chief medical officer that I'm talking to. It's the chief strategy officer, the chief financial officer, the chief executive officer. These were business conversations. This isn't value-based care. This isn't an accountable care organization. Those are great models. They're not there yet. This was, hey, how do we ensure we cover more lives? And when I made that very clear to the healthcare executives, in some cases with some great data from some of the medical fitness centers that are out there. David, your former health system that you came from, Hancock had some great data. And I was able to support the fact that, they would see patient acquisition from this. That's when it became, a no-brainer. So I think that's the first lesson is, right now, I think the true value in medical fitness to the health system's bottom line is we are tip top of funnel. Like if primary care is top of funnel in healthcare, I consider medical fitness like tip top of funnel. So that's lesson one. Lesson two, and I really, really believe this. In order for the medical fitness model to scale, it cannot be so capital expenditure and real estate intensive. The fact that I've been on this journey for 4 years, and it's going to be 5 or 6 years before I get this open, this is no way to scale a business. So I think there's a lesson to be learned from some of the high growth uh, business models that are out there in the fitness industry. And I'm not saying we would emulate their practices, but their business models are worthwhile looking at. Orange Theories and F45s and solid cores. There's a model there that's a small footprint medical fitness model that is more turnkey. It's not as capital intensive or real estate dependent, that I think can really be a game changer. And so it's a model I'm working on, because I'm only going to go through this craziness a couple times in my life of trying to build a $10 million center. I mean, David, you went through it once at Hancock, and then you left for an easier job running the Medical Fitness Association. So like it just strikes me that we have an opportunity. So I'm going down this path, and I would challenge everyone listening, like, this is our growth opportunity, particularly in light of what we talked about with the QHP movement a second ago. Like, if you can marry that up with a scalable, smaller footprint medical fitness model, I think it's a game changer. So those are my big lessons, but stay tuned, because I'm quite sure you bring me back a year from now, I'm going to have more lessons that I've taken away.
Hey,
That's awesome. Yeah.
what goes
Uh,
through David, what goes through your mind when you hear Mike say all that stuff? I'm really curious.
No, he's hitting on quite a bit, and I we're definitely going to have you back when right
Yeah.
before you open, or maybe after
Sure.
you open, to kind of hear a little bit more of this journey, because it is really interesting. It's a new perspective. Like you said, it's not a healthcare system initiating this, as the norm probably is, but the opposite, the other way around. But you brought up Doug Ribley, and he's a mentor to me. He's one of the gurus in the medical fitness industry, and I learned so much from him. And so you're talking a lot about the same language that I hear, and a lot of things that we talked about is you can say it where without a margin there is no mission. So yeah, we're all about improving lives and making people healthier, but if you can't have a business model that supports it and have a healthy margin, and if you're part of a large organization, kind of feeding back into that system, or even as an independent, being able to put money away for growth in the future and things like that. But yeah, I mean that it's and I can remember, yeah, I actually did two projects, and you have to right size them too, because I've been part of projects. I came in afterwards, and they were too big,
Mm.
and it puts tremendous pressure on the facility, and sometimes doing things that really aren't aligned with the vision, the mission, and the values that you talked about. So I do think that's a huge point that can't be underestimated. A lot of times, people want four pools, and a huge basketball court, and all these things, and well, is the market going to support it? Because some markets will, but some markets won't. And then a change in the CEO of a hospital that just signed off on this before, the new guy might say, no, this is killing us, we can't do this, unless you're really knocking out of the park. And like I said, there are some facilities that will support that. So but I think your point is right around this, right sizing it and making sure that whatever you're doing, the market supports it. And so, yeah, I think it's interesting hearing your whole perspective of actually going through this. It's taking longer maybe than you anticipated.
Yeah, when it's your own money too, like that's yeah, it's very different when you're spending somebody else's money. Like, this is my money that I see go out of the bank account, and you learn lessons really, really quick when it's your own money. So that's again, I think I have some insight to provide, and Doug and I have joked that we're gonna have to write a book, when this whole thing is over. So stay tuned for the book.
By the way, most people looking for the services of a fitness professional are really just looking for information on how to get started on the right path, not to pay for training sessions every week for months or years on end. For the 60 to 70% of people with chronic disease and or joint pain, they're also looking for someone who can help them develop a clinically safe, individualized exercise program that takes their conditions into consideration. If you're interested in getting yourself or for clinicians, your patients started on a safe, cost-friendly medical fitness program, you can find more information about the virtual services we offer at mrfinstitute.org/services. We staff only degreed kinesiologists and exercise physiologists and will work with your healthcare providers in the design of your exercise program. For the clinicians listening in, you can add this virtual service as a reduced cost option for your patients. Check out our website and send us an email, and we'll give you the details about this unique and much needed service.
Well, let's switch gears just a little bit here. We've touched on some of these things, but we've had you at several MFA conferences, and I think you've always been really well received. A bunch of different topics, so I really appreciate that. We've got our regional symposium in Michigan in August,
Mhm.
so I'm looking forward to that. You're a speaker on that agenda. And so there, I know you're going to be talking more on the importance of advocacy. We've touched on that a little bit. Maybe you can dive into that a little bit more. And then the other one that's coming up that I'm also really excited about, our annual conference in New Orleans in November. You're presenting on outcome data, which is, I think, one of the biggest topics in medical fitness that one of the big differences. So just maybe go into what you're going to talk about at each of these conferences a little bit more.
Yeah, I'm very excited for both of these topics. I had the opportunity to talk on advocacy down at the Medical Fitness Summit in North Carolina, and so I'm also going to do it here in my home state of Michigan. And I guess first I'll zoom out from an advocacy perspective and say that it is just a lever for policy and systems change. And I talked about how impactful I feel like that is, and I think the thing that got me to realize the impact of advocacy more than anything else was the COVID-19 pandemic and the work that I did with the Michigan Fitness Association here in the state to not only get us reopened, but to get us an $8.5 million grant from the state of Michigan for improving the health and well-being of Michiganders. And, to our knowledge, that's the first time in the history of our industry that a trade association got dedicated funding to improve the general health of a population. And I think prior to COVID, I was very cynical on politics. The irony is that I think COVID made most people more cynical on politics, but for me, it actually showed me that my voice really could make a difference. And it really started to get me thinking more about just kind of fundamentally my civic responsibility as an American. I guess first off, like this amazing privilege that we have here in this country to actually be able to advocate for what we believe in and freely speak about what we believe in. And so I think it really stirred something deep inside of me from an impact perspective. But then as time went on, I started to realize all the different levers through which you can be an effective advocate for our industry. And again, through my work with Michigan Fitness Association, through my work with Physical Activity Alliance, we're going to touch on Michigan Moves Coalition, I think, in a little bit. And I just started to realize, wow, there's a method to follow. And when the pandemic started, I had no idea what it was like to be an advocate. The Michigan Fitness Association didn't form until May of 2020. It was me and the guy who owned a bunch of the Planet Fitnesses and the guy that owned the Powerhouses and some F45 guys. And it was kind of this like motley crew of fitness business owners who knew nothing about politics, but we figured it out because we were passionate. And I think we were representing the industry in a way that painted the industry in a different light than what lawmakers thought of our industry. It's very clear that they thought something very different about our industry than what it really was during the pandemic. And so I guess what I'm going to be talking about at the Michigan conference or the Midwest conference is kind of a framework for how you can become an advocate for our industry. I didn't have the MFA, Michigan Fitness Association. So that kills me that the acronyms are the same. Just so you know, we were the Michigan Fitness Club Association, and then they wanted to change the name to the Michigan Fitness Association, and I voted against it because I didn't want to have this confusion. But they're the MFA. The MFA is the MFA. I have different folders on my computer and everything works. So the Michigan Fitness Association, we didn't have any lessons. And so I think it's important to provide frameworks for people to operate within. And so that's what I hope to give people at that Midwest Summit is a framework as to, well, first, why it's important to be an advocate and understanding a little bit of our civic responsibility and what the First Amendment gives us the privilege of doing in this country. And then from there, what's the step? What's the framework? If you want to become an advocate, what do you do? So it's the first time I gave a talk was in North Carolina. I really thought it was well received. I thought a lot of people were surprised of some of the issues that our industry is facing right now that are very, very onerous. That we could talk about those and how sometimes killing legislation that could be onerous to your industry is more important than advancing legislation that elevates your industry. So I think it's a topic that's not talked about enough, and people need a framework to operate within. So that's that. Yeah, and then we have the national conference, and I've been thinking a lot about what our industry needs to do to prepare for this QHP movement that's coming. And to be honest, there's a decent part of me that's scared. Scares maybe not the right word. That's concerned that we're not going to be ready when it gets here, and not from a passion standpoint. Maybe in the case of medical fitness, not even from the ability to produce outcomes, but how do we actually develop the disciplined process of collecting data, aggregating data, reporting data, you're doing all the things that are necessary with a level of healthcare compliance and data privacy that's necessary to ensure we can work in a healthcare ecosystem. And I also think that there's going to be some great opportunities to find the holy grail in our field, which is taking fitness outcomes, tying them to health outcomes, and then tying them to claims data. Like if we can follow that through line and we can make the economic case for the ROI and what we do, which we know exists, but we have yet to actually quantify its scale, that becomes a game changer. But it's important to understand a good framework for how you collect data properly, how you manage that data, and what you do with it. So I've been on a process in my organization and do this for a while, and I'm essentially going to share my framework along with some work that's happening in the Physical Activity Alliance and some other groups to basically provide what I think is a decent formula for a starting point. I don't think I have all the answers. I don't think it's perfect just yet, but I want to put it out there in the public domain and have other people play around with it and come up with a good solution. But if we are not ready from just a data infrastructure and analysis perspective, it's going to be very, very hard for us to play at scale in healthcare as a QHP.
Nick, do you know what day of the week that presentation at the annual conference is going to be at or
Oh,
going to be on?
I should. I don't know. I'm there the entire week. Is it
Yeah.
Wednesday morning, David?
Yeah, you're at 8 o'clock. First spot of the
Oh,
day on Wednesday, November 20th.
okay.
All right.
Yeah.
Got it.
Yeah.
Early have your coffee, folks.
Yeah. Because I haven't purchased my tickets yet, and I'm gonna be in the very near future, so I'd like to try to catch that one. It kind of stinks that we're slowly running out of time because I would love to just talk about that more, but I want to continue with the same theme with the Medical Fitness Association conference because you got another presentation going on and it happens to be with me. So,
Mhm.
or me and Dr. Andrew Mock, who's just for the listeners, he's board certified in family, lifestyle, and preventive medicine. He's a four-time strongman champion. So, what a unique perspective he has with just a lot of different things as well. But we presented at the American College of Lifestyle Medicine's conference last fall, and we'll be doing it again this fall, just a few weeks prior to the annual conference, and then we'll be doing something similar again at the Medical Fitness Association's annual conference, obviously tweaking it for a different audience. So, can you talk to our listeners about our presentation a little bit and why it's an important piece of building the bridge between medicine and fitness? Or maybe in this case, it's more appropriate to say building the bridge between medicine and progressive strength training.
Yeah, I guess first, foundationally, it's very invigorating to be able to give a talk with two other professionals that bring similar but slightly different perspectives. It's also very humbling to stand next to Dr. Mock, given
It
the
sure
fact that
is.
he is a strong man. We have a picture from when we were out in Denver, Jeff, and he makes me look like a child.
I'm
So
telling you.
if nothing else, come to see Dr. Mock dwarf Jeff and I, but certainly me.
Exactly right.
But I mean, so two things. One, and I think you very much feel the same way. I was very heartened and excited at the ACLM conference how many physicians signed up for that workshop.
Yeah.
We sold it out. It was off site. We could have had 50 more people there, and they
It
would have.
was 8 inches of snow.
Yes, yeah, that's a whole other thing entirely. And we could have doubled the time. And so it excites me that physicians are starting to realize the importance of strength training. But what I think what we realized, you, I, and Dr. Mock, when we were talking about this, is there's a real opportunity to make sure that the medical fitness community as a whole understands and embraces the evidence-based practice of progressive strength training. And I think strength training in healthcare over the years I think has been underemphasized, underdosed, underprescribed, largely out of fear of complication. And I think a lot of that just stems from professionals not understanding the evidence basis for appropriate progressive strength training. So I think the perspective that you and I bring, I'm an exercise physiologist, you're a kinesiologist, medical fitness practitioner, Dr. Mock is a physician. We all not only understand, I think, the theoretical basis, but how it's applied in the real world. And I think what the actual workshop gives you is not only our view on the program design and the theoretical element based upon the evidence, but also how to implement and coach the actual movements and then make necessary modifications to those movements for individuals who have orthopedic limitations. And we're all well aware that medical and orthopedic issues, although they look the same in the textbook, the way they exist in individuals varies tremendously. And I think there's no substitute for the experience that we have as a trio of actually working with people. And so that's why I'm excited about this, because we're going to go theory and program design right into practice and implementation. So I think it's a really unique opportunity. We're actually going to do the lifts. We're going to coach people through things. And so I think it's a great opportunity for even people who have an experienced background with strength training to really reconnect, not just with the latest evidence, but I think also more importantly to be able to benefit from I need a calculator to probably do the math of our years of combined experience. But I would venture to say it's probably over 60 years of combined experience that we bring to that presentation. And I'm just grateful that David and the MFA are allowing us to pull a workshop together and at the end of the conference. And I think it's going to be a really fun, dynamic way to learn about something that is of increasing importance in the eyes of the public and the eyes of medical professionals.
Absolutely. I'm really excited about it. And David, thank you also again for me as well for this opportunity.
Yeah, let's plug it just a little bit more. So it's Thursday, November 21st, the second day of the conference. It's a two-part series here. So it's going to be a 2 o'clock part one, and then a 3 o'clock part two. So you get done with your lunch, you're feeling good, and then you're gonna do some lifts and hear some really some of the experts I think in the field right now. So I'm excited to hear it myself and for our audience there to hear. So really, great, grateful for you guys doing that as well. So Mike, let's move on to you. You mentioned Michigan Moves Coalition.
Mhm.
And I know you were instrumental in forming that and working in conjunction with the Michigan Department of Health and Human Services, really to improve the physical activity levels in Michigan, where you live. So maybe tell us more about what that coalition is, why it was formed, what your role is, and the future of it. What's going to happen going forward, and then lastly, recommendations on how other people, maybe in other states, may look to replicate this?
Yeah, thank you for asking. I think of all the things I'm doing right now, I may be most excited about the Michigan Moves Coalition. And the genesis of this was originally myself and a colleague of mine who teaches at Eastern Michigan University, who's on the governor's council for physical fitness here in Michigan. He said, we should do a messaging event in May which is National Physical Activity Month, where we talk about the importance of physical activity. And of course, alliteration being what it is, Michigan Moves Month was born, and it started as a messaging campaign. And to do that, I realized we needed to build a coalition that was broader than just the fitness industry. And that was, coalition building is something that I've really learned over the years from an advocacy perspective. It happened with the Michigan Fitness Association. It's what the PAA is doing. It's what the Coalition for the Registry of Exercise Professionals is doing. It's groups. It's a group of individual organizations or people coming together to speak with one unified voice on a very salient issue. And so I went out, and this colleague of mine went out, and we brought in the American Physical Therapy Association, Michigan branch. We brought in the Society of Health and Physical Educators, Michigan. We brought in the Parks and Rec Department. We brought in the Governor's Council, and we started this messaging campaign. And it was very grassroots. We really didn't have a roadmap, and we just we bootstrapped it. And the Michigan Department of Health and Human Services saw what we were doing. I was able to get in contact with their head of chronic disease, and just to talk about how the Michigan Moves Coalition could be in service of the population in the state. And I said, well, what do you guys need? And to kind of go back to my values, what would make an impact? And what they said to us was, we desperately need a state level physical activity plan, a document that would guide the strategies, the tactics, and the evaluation of physical activity initiatives in the state. And as soon as the director Scarpetta said this, the light bulb goes off, because one of the main assets of the Physical Activity Alliance is the National Physical Activity Plan. But the national plan was never meant to be something that was about implementation. You've probably heard the statement before that all health is local. Really, physical activity plans are meant to be implemented on a local level. So what we've evolved into is a nonprofit that now has a member of the Michigan Department of Health and Human Services sitting on our board of directors. The MDHHS has a permanent board seat on our board of directors. And we are working to take the National Physical Activity Plan, modify it, and pull it down to the state and local level with a focus on implementation and measurement of impact. And that's the important thing that we really want to emphasize with the coalition is we are not interested in just writing another white paper that says that exercise and movement is a good thing. We don't need any more white papers that say that. Like we're all uniformly agreed. What we need to show is that we can get people to do it. And we believe that the state level physical activity plan, with an emphasis on implementation and surveillance and measurement, is the way to move the needle on physical activity levels in the state. So we're in the process of broadening the coalition. I won't get into a lot of the details, but we hope to start end of this year, beginning of next year, authoring the plan. And then from there, we're hoping to finish it up in 2025 and then start to get an implementation in 2026. So if you check out our website, MIMoves.org. MIMoves.org is the website for the coalition. I am the one of the founding board members and kind of the driving force behind it, operationally. I'm also an entrepreneur and a fundraiser. So, these things require money. So, part of my job is to go get the money. And fortunately, there's a lot of vehicles to do that through. So if anybody's listening, there's a dire need for state and local level physical activity plans. The national plan was never designed to be implemented at the local level in your community. It was designed to be a broad policy document that can be pulled down by states and cities and implemented in their communities. And so, if anybody's interested in knowing more about this, you can please feel free to reach out to me. But on a broad level, I think your first step is kind of familiarize yourself with the national plan. It's 100 pages long. You don't need to read the whole thing, but get a gist of it. and then start to form a coalition of like-minded individuals and physical activity stakeholders in your community. That's the starting point. You can't go it alone on this. This takes a whole of society approach to be able to do effectively. And the reason that MDHHS, our Department of Health and Human Services, wanted to be a part of this wasn't because what I said was so compelling. It was because of the coalition I put together. It's because of the groups that we were represented by, and you can see that on our website, were so varied. American Heart Association, Trinity Health, the Michigan School Counselors Association. We had so many people under the tent. They said, wow, this actually could make a difference because you have scale and depth in your organization. So more to come there. Again, maybe when we come back to talk about the medical fitness center we build here in Ann Arbor, I can tell you more about the plan, but I'm very excited about it. It has a chance to make a big impact.
Well, guess what, Mike? I am going to be one of the people who reach out to you, and I really mean it. This is very exciting for me to hear because I have some connections at the state level and the local New York City metro area level, and maybe even with happening to David as well. But this is something that it's kind of funny that you mentioned the white paper because this National Strength and Conditioning Association Special Populations Group. We've been talking about writing a paper. We didn't know if it was going to be a white paper, position statement, but I'm so glad to hear you say, what you just said, because the light bulbs are going off in my head. And I'm just thinking, we really need to use our connections along with other networking with other people's networks and make some stuff happen. So I really am going to reach out to you regarding this as well. And I hope a billion other people do too. But as I look at the clock, I realize we need to wrap up. So as we wrap up, I want to give you the opportunity to at least, tell people more about your podcast and where they can connect with you or follow you online. Um, and then we'll wrap it up.
Yeah, thank you for that. So my podcast is the Wellness Paradox podcast. Both of you have been guests on the podcast before, and thank you for that, Jeff. You've been guest twice. And you can
And
find
a
that.
better guest than David. I want to point that out as well. So.
I mean, well, that's why you've been on twice, and he's only been on once. I mean, no, he hasn't got the invite back yet. No, you guys have both been great guests. So you can find that at wellnessparadoxpod.com. That's wellnessparadoxpod.com. I am active on social media. You can find me on LinkedIn, just Michael Stack on LinkedIn. I'm also Wellness Paradox on all of the major social media platforms. I've got a great social media team. And Jeff, you said it before. I mean, connect. I am someone that is willing to take a conversation with anyone at any time. That's originally how our relationship got started, and we're collaborating. So if you hear something on here that resonates with you and you want to touch base with me, you just DM me on any of the social platforms. And I love to connect. I love to network, and I love to be able to provide people some of the tools that I have learned over time to do the same things that I'm doing in Michigan or in my business in their states and in their businesses. So I appreciate having the opportunity to come on, and to the audience, please reach out.
Yeah, thanks, Mike, for being on. I understand your podcast. Only having me on once. I don't know if it's as much you not inviting me back, but it has this University of Michigan flair to it. So Jeff mentioned the Ohio State, Penn State, Michigan thing, and for those of you who don't know, I lost the bet last year.
I wasn't gonna,
I'll bring it up. Yeah,
bring this up. I
no,
wasn't.
if this gets more people to the conference, then I'm happy. But I have to wear this ridiculous maize and blue jersey or something, at the conference because of what happened in football last year. So it's always fun to do that. But yeah, I think one of my first times I met you, I was on your kinesiology class.
Yeah, you were in my you were guest lecturing for my class. Yeah.
Yeah, yeah, and it was really hard to do as a Buckeye, but it's when you have this much good information from a guy like you, we got to have you on the podcast.
You
So.
just swallow your pride. Yeah. If nothing else, yeah, forget my lectures, Jeff's lectures, all the lectures at MFA National. Come to see David in a Michigan football jersey, special ordered jersey, Flench right on the back.
Yeah, it's not going to be pretty, guys.
I love it.
So, well, guys, thank you so much for having me on. It's been an absolute pleasure.
Mike, thanks
All
so
right.
much. Fun to listen to you.
Thanks, Mike.
Yep.
The Medical Fitness Podcast is brought to you in part by the Medical Fitness Association. If you'd like to hear more from Mike Stack, he'll be presenting at the Medical Fitness Association's annual conference this November 19th through the 21st in New Orleans. Don't miss this great opportunity to hear from and network with leaders in the medical fitness industry. For more information about the Medical Fitness Association's annual conference and to register, visit medicalfitness.org. That's medicalfitness.org.